Hi, my name is Jennifer Slade, and today we're going to be talking about the Ontario COVID-19 Working Income Protection Benefit. In January of 2020, the World Health Organization published guidelines related to the management of an outbreak of a new disease, now known as COVID-19. In mid-March of 2020, the Ontario government implemented strict rules and lockdowns to help stop the spread of this disease. Many employees experienced significant wage loss in the process of being compliant. In response, among other financial measures, the Ontario government implemented the Ontario COVID-19 Working Income Protection Benefit. This new legislation was implemented in April of 29th of 2021 and was retroactive to April 19th, 2021. This amendment to the Employment Standard Act required employers to provide their employees with up to 3 days of paid infectious disease emergency leave for certain reasons related to COVID-19. Employees are also eligible for unpaid infectious disease emergency leave as well. The reasons that are approved for taking these days are going and getting tested for COVID-19, waiting at home for results of a COVID-19 test, being sick with COVID-19, getting individual medical care for mental health related to COVID-19, getting vaccinated for COVID-19 or experiencing side effects of the vaccination, being advised to self-isolate due to COVID-19 by employer, medical provider, or other specific authority. And finally, providing support and care for certain reasons related to COVID-19. For example, being sick with COVID-19, having symptoms of COVID-19, being told to self-isolate by a medical provider or other specific authorities, and providing care or support for their child who is going to get vaccinated or is experiencing side effects of the vaccination. Key features of this benefit are employers are generally required to pay employees the wages that they would have earned if they had not taken this leave, up to $200 per day, up to 3 days. Eligible employers are entitled to reimbursement of the amount of the infectious disease leave pay that had been paid to the employee, up to $200 per employee of day taken. This reimbursement is done through WSIB. Employers have the discretion to count a half day either as a half day or as a full day, but it is important to note that employers are only eligible to be reimbursed for the first 3 days of claim per employee. It doesn't matter if that is a half day or a full day to the employer. For regards of being reimbursed, it is considered a full day. It is also important to note that doctor notes are not required to take these leave days. Even though COVID-19 is new to legislation, the history of personal emergency leave days or sick days being paid or unpaid in Ontario is not new. Prior to 2018, if you worked in a workforce that had 50 or more employees, you were eligible to take up to 10 unpaid job protected leave days per calendar year for illness, injury, other urgent matters, or emergencies. In January of 2018, Bill 148 came into effect, allowing for all employees to be eligible for 10 emergency personal leave days, and 2 of which of those days were to be paid. The requirement for those days to be paid were that the employee had to work for the employer for more than 1 week. This also prohibited employers for asking for doctor's notes or certificates for these absentee days. In January of 2019, Bill 47 came into effect, removing the paid emergency leave days and restructuring the 8 remaining unpaid days. They were restructured into 3 different categories: 3 unpaid sick days, 3 unpaid family responsibility days, and 2 unpaid bereavement days. It also removed the prohibiting of the employer asking for a doctor's note. So now employers are able to ask for a doctor note to back up these absentees. In December of 2020, the reading of Bill 239 was read. This bill did not come into effect, but it was promoting to increase the amount of paid sick days and reintroduce them. And it was promoting to have 7 sick days, family responsibility, bereavement, and personal emergency leave days, 7 paid days per year. And if there had been declared a emergency, an infection disease, or a infection disease emergency, this would be increased to 7 paid days in a year. That legislation didn't come into effect, and obviously in April of 29th of 2021, the Ontario Working Income Protection Benefit did come into place. It is important to note that it is a temporary benefit. It has been already extended multiple times, and the current expiration date is March 31st, 2023. Impact to an organization. The organization needs to take this new legislation and add it to their comprehensive COVID-19 measures, policies, and procedures. The company also needs to determine their established protocols to this new benefit. So, how is it being submitted? What are the forms? What are you creating shared drives to have reporting, tracking, and approving of these days, and having open communication with managers, HR, and payroll to establish this. It is also important to have information spread and also training to relevant staff, including payroll, to make sure the accuracy of the submissions are correct. It's also really important as an organization on determining what level of payout you want to do. So, do you as an organization want to go above and beyond the new legislation or not? My company has personally decided for salary employees, if they do make over the $200 per day, we are going to pay them their normal salary. And for our hourly staff, we are staying with either what they would have earned if they hadn't taken the leave, up to the $200 a day as per the legislation. There's a lot of decision making that and factors that come into making these decisions. And you also need to consider if you are working in a union or non-unionized environment when making these decisions for the organization. The impact to payroll, it is definitely going to cause more time and just more paperwork in order to process the payments to the employees and also the reimbursement to make sure that the company gets reimbursed for these claims. One of the first things to potentially look at is your software. Does your software already have sick days put into place as a code, or is this something that you need to add? Either way, when the code is set up, I would recommend setting up limits to it so that at least you have some internal control to have a warning system in case your other tracking measures have errors within them. Just a nice internal control. It's important to have continuing communication between managers, HR, and payroll to make sure that the tracking forms are up to date, that they're accurate, that we are getting the forms from the managers or the employees, depending on how you've decided to have that communication channel work, and make sure that they are approved as well. Um, you also need to make sure the eligibility for this reimbursement or for the payout. There are several things that would make you not eligible. Um, Three of those would be the employee received WSIB benefits on the same day of the leave. We wouldn't be able to do that because that would be double dipping. The employer canceled or restructured their paid leave offer to employees as part of their employment contract on or after April 19th of 2021. And also we need to make sure that the employee hasn't already used up their 3 days as well. We also do need to make sure that our tracking, recording, payout, and filing steps are all in place, and that training has been provided for those. And then there is also the impact to actually processing this benefit through the regular payroll and making sure that we are paying out our employees for the reimbursement correctly. And then it's also important to note that these claims for to get reimbursed for the employer have to be done within 120 days of the leaves that you are submitting for reimbursement. This may be something that you want to add to your monthly or quarterly list. You are also able to do a batch. If you're going to do 50 or more employees, there is a separate process to do that. If you are just going to do a few employees, there you can do that right on the WSIB platform, and just make sure that all employees in those batches are within that 120 days in order for you to get your reimbursement as an employer. So these are the main resources that I used in my research. I hope that today you enjoyed the presentation, hopefully walked away with a little bit more information. And if you are finding this an interesting topic, you can easily dive in and find some more information. But these are the highlights and key points of the Ontario COVID-19 Working Income Protection Benefit. I hope that everyone is having a great day, and thank you very much.